And in terms of contractors, you have to give advance notice as well, at least as I understand it.
The House is back in, expected to take up a bill dealing with medical disaster response programs.
On which the vote incurs objection under Clause 6 of Rule 20. Any record vote on the postponed question will be taken later. For what purpose does the gentleman from Pennsylvania seek recognition?
Mr. Speaker, I move to suspend the rules and concur in the Senate amendment to the bill H.R. 307.
The clerk will report the title of the bill.
H.R. 307, an act to reauthorize certain programs under the Public Health Service Act and the Federal Food, Drug, and Cosmetic Act with respect to public health security and all hazards preparedness and response and for other purposes.
Pursuant to the rule, the gentleman from Pennsylvania, Mr. Pitts, and the gentleman from New Jersey, Mr. Pallone, each will control 20 minutes. The chair recognizes the gentleman from Pennsylvania.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection.
Mr. Speaker, I yield myself such time as I may consume.
Gentleman's recognized.
H.R. 307, the Pandemic and All Hazards Preparedness Reauthorization Act of 2013, introduced by my colleague Mike Rogers from Michigan, would reauthorize programs designed to foster the development of medical countermeasures and strengthen the nation's preparedness infrastructure. These programs are essential to helping our nation prepare for public health emergencies, including those caused by terrorist attacks. H.R. 307 reauthorizes programs for 5 years at the fiscal year 2012 appropriated level and does not create a new program nor increase the authorization for appropriations for an existing program. According to the Congressional Budget Office, the bill does not increase spending. Congress originally enacted the programs reauthorized in H.R. 307 through the Project BioShield Act of 2004 and Pandemic and All Hazard Preparedness Act of 2006. Project BioShield authorized funds for the purchase of medical countermeasures through the Special Reserve Fund and enabled the Secretary of Health and Human Services to authorize the emergency use of medical products. The original PAPA bill created the Biodefense Advanced Research and Development Authority within HHS to help with the development of medical countermeasures and increase communications between HHS and the developers of MCMs. The House passed H.R. 307 back in January. The Senate made some minor changes to the bill and passed it by unanimous consent last week. I would like to commend Chairman Upton, Mr. Rogers, Mr. Waxman, Mr. Pallone for their work on the bill. I also would like to thank Senator Harkin, Senator Alexander, Senator Enzi, and Senator Burr for their leadership. And I would urge all members to support this critical piece of legislation, and I reserve the balance of my time.
The gentleman reserves. The gentleman from New Jersey, Mr. Pallone, is recognized.
Mr. Speaker, I ask unanimous consent. I ask to use such time as I may consume.
The gentleman is recognized.
Mr. Speaker, I'm pleased to rise in support of the Senate amendment to H.R. 307, the Pandemic and All Hazards Preparedness Reauthorization Act of 2013, and I want to recognize the work that Ms. Eshoo, my colleague on the committee, has been doing on this legislation for many years. This legislation reauthorizes critical programs and activities first established as part of the Public Health Security and Bioterrorism Preparedness and Response Act of 2002, the 2004 Project BioShield Act, and the 2006 Pandemic and All Hazards Preparedness Act. H.R. 307 passed the Senate in late February with an amendment that makes some changes to the House version passed in January. And the new language updates the authorization period of programs to fiscal years 2014 through 18 instead of fiscal years 2013 through 2017. It also modifies the authority for a state, territory, or tribal organization to temporarily reassign public health personnel to respond to a public health emergency. In addition, there were some minor technical corrections to the House-passed legislation. Over the past decade, Mr. Speaker, these programs have represented comprehensive efforts to prepare for and respond to public health emergencies. And as a result of the investments that followed, our nation is better equipped to respond to public health emergencies. But there's still a lot of work to be done. Our nation continues to face threats that require an ongoing commitment to public health and emergency preparedness. Of course, I'm thinking of my district and the state of New Jersey after we experienced a devastating storm that destroyed entire communities. The federal government's support, including programs authorized by PAPA, were critical in the wake of this disaster. So I'm pleased that Congress is finally able to get this legislation across the finish line. It reflects a bipartisan, bicameral effort that has been ongoing for more than a year, start to finish, and members and staff have worked hard to see it through. Together we've resolved differences and made compromises the way legislation is supposed to be done, and I was proud to be part of the process. But I'd like to thank many members of the Energy and Commerce Committee who contributed to this important bill. Of course, Ms. Eshoo, who will speak, Congressman Mike Rogers and Jean Green, Chairman Upton, Chairman Pitts, Ranking Member Waxman, and Congressman Markey and all their staffs. Everyone should be commended for the work, and I urge members to join me in supporting passage of the Senate amendment to H.R. 307 and look forward to finally getting this bill to the President's desk. I reserve the balance of my time.
Gentleman reserves. Gentleman from Pennsylvania is recognized.
Mr. Speaker, I yield such time as you may consume to the chairman of the full committee, gentleman from Michigan, Mr. Upton.
Gentleman from Michigan is recognized.
Well, thank you, Mr. Speaker, and certainly tonight I stand in support of this legislation, H.R. 307, the Pandemic and All Hazards Preparedness Reauthorization Act of 2013. This legislation is going to help our nation's families, local communities, first responders, and innovators as we prepare for and respond to public health emergencies, including those caused by terrorist attacks. As the nation recovers from a severe flu season, the need to pass this legislation is ever more apparent. This bill is going to help families by requiring that the special needs of our nation's children are taken into account as medical countermeasures move through the FDA process and are purchased for the Strategic National Stockpile. The bill also would require the Department of Health and Human Services to improve public health emergency preparedness, response, outreach, and communications with respect to children. H.R. 307 also would aid local communities and those on the front lines in disaster response, providing assistance to local law enforcement, emergency management, and public health officials in planning, training, and preparing for emergencies so that if disaster strikes, their communities are ready. Last month, I had the opportunity to address the American Burn Association here in Washington. The bill's hospital preparedness program is critical to help them as it helps hospitals prepare for disasters that would result in a surge in the need for medical care. In addition, this legislation is going to help innovators as they develop medical countermeasures that may be necessary in the event of a biological, nuclear, radiological, or chemical attack. The bill contains provisions to improve the predictability, consistency, and transparency of the FDA process. These improvements will assist innovators in getting their medical countermeasures across the finish line. It's also important to note that H.R. 307 would reauthorize programs for 5 years as fiscal year 2012 appropriated level. This bill would not create new programs and, according to CBO, as Mr. Pitts said, would not increase spending. The House bill passed back in January, and the Senate passed a nearly identical version of the bill last week by unanimous consent. Upon House approval today, this critical legislation will in fact head to the President to be signed into law, ensuring that our nation is preparing for the unthinkable. I want to thank all of the members who have worked on this issue, not only this year, but last year. Certainly Mr. Rogers of Michigan, Chairman Pitts, Mr. Waxman, Mr. Pallone, Mrs. Eshoo. I also want to thank our Senate colleagues, Senator Harkin, Alexander Enzi, and Senator Burr for their leadership on this issue as we got together and got this bill ready tonight. So I would, at this point, yield back and urge my colleagues to support the bill. I yield back my time.
Gentleman yields back. Gentleman from New Jersey is recognized.
Mr. Speaker, I ask unanimous consent to enter letters of support from the following organizations into the record: the Alliance for Biosecurity, the American Academy of Pediatrics, the Biotechnology Industry Organization, the Roundtable on Critical Care Policy, and we have a joint letter from the American Public Health Association, the Association of State and Territorial Health Officials, the National Association of County and City Health Officials, and the Trust for America's Health. I ask unanimous consent.
Without objection, so ordered.
And, Mr. Speaker, now I'd like to yield such time as she may consume to the gentlewoman from California, Ms. Eshoo, one of the key sponsors of this legislation.
Gentlelady from California is recognized.
Thank you, Mr. Chairman, and I thank our ranking member, Mr. Pallone, for his leadership at the committee and for yielding time to me. Mr. Chairman, I rise today to support the Pandemic All Hazards Preparedness Act reauthorization. This is legislation that I wrote together with Congressman Mike Rogers, going back to we first introduced it in 2006. To better help our country prepare for a chemical, biological, radiological, or nuclear attack. All the things that are really unthinkable, but in a post-9/11 era, we had to be prepared. And so we developed this legislation. So it pleases me enormously that we are now reauthorizing it. And you know, I mean, the American people right now are left wondering what the heck the Congress is doing, why we can't come together, why we can't work on a bipartisan way and develop consensus. Well, you know what? On this bill, we are, and I'm very proud of that. Developing and stockpiling appropriate countermeasures is essential for the safety of the American people. And these programs encourage American companies to invest in areas of critical need. The bill before us today includes new provisions, which I think really enhance what we did originally, provisions that highlight the important needs of our nation's children. Children are not just little adults. They need special care and medical attention. They're especially vulnerable to biological or chemical agents because of their size, their limited capacity to flush out toxins, their underdeveloped motor skills, and their total reliance on their parents or other caregivers. I know firsthand the importance of stockpiling vaccines, critical to our public health. I recently visited a company in my district, Bavarian Nordic, a company which clearly demonstrates that technical expertise and investment in this area must be backed by the government's commitment to preparedness. Because medical countermeasures don't always have a natural commercial market, it's our responsibility right here in the Congress to encourage and incent private companies to develop them. And when I was meeting with them, they told me that when we were considering the original legislation and then passed it, they were immediately invested in by the sum of some $80 million. Because there was confidence that in that particular market. So this legislation is supported by many, but I think it's a real honor roll in terms of the groups and organizations: the American Public Health Association, the Association of State and Territorial Health Officials, the National Association of County and City Health Officials, the Trust for America's Health, and the American Academy of Pediatrics. This legislation, the Pandemic All Hazards Preparedness Act reauthorization, did pass the House last month, and it also passed the Senate last week, as my colleagues have said on both sides of the aisle, with minor changes. Today, I once again urge my colleagues to vote yes on the Senate amended bill so that it may swiftly be sent to the President for his signature. And I think together we'll have something to celebrate, because this is not only important, but will and can and will make a difference for the American people. So with that, I yield back the balance of my time.
Gentlelady yields back. Gentleman from Pennsylvania is recognized.
Mr. Speaker, I have no other speakers and continue to reserve.
Gentleman reserves. Gentleman from New Jersey is recognized.
Mr. Speaker, I have no additional speakers, so I could just say at this point that I would urge passage of this legislation. It's very important in terms of our ongoing commitment to public health and emergency preparedness. And of course, once it passes today, it will go to the President for his signature. So I would urge passage and yield back the balance of my time.
Gentleman yields back. The gentleman from Pennsylvania is recognized.
Mr. Speaker, I too urge all members to support this critical legislation. It has strong bipartisan support. It's very important. And with that, I yield back the balance of my time.
The gentleman yields back. The question is, will the House suspend the rules and concur in the Senate amendment to H.R. 307? Those in favor say aye. Aye. Those opposed, no. In the opinion of the Chair, two-thirds being in the affirmative.
Mr. Speaker,
The gentleman from Pennsylvania is recognized.
I request the yeas and nays.
The yeas and nays are requested. All those in favor of taking this vote by the yeas and nays will rise and remain standing until counted. A sufficient number having risen, the yeas and nays are ordered. Pursuant to Clause 8 of Rule 20, further proceedings on this question will be postponed. Placed before the House a communication.
The Honorable the Speaker, House of Representatives. Sir, pursuant to 44 United States Code 2702, I am pleased to appoint Mr. John A. Lawrence of Washington, D.C. to the Advisory Committee on the Records of Congress. Thank you for your attention to this appointment. Signed sincerely, Nancy Pelosi, Democratic Leader.
Pursuant to Clause 12A of Rule 1, the Chair declares the House in recess until 6:30 p.m. today. Gavel?